Hey YouTube, it's Carrie, Lady VSG, here with a midweek update. I wanted to do a video basically about my gallbladder adventure. So I know I've mentioned in previous videos that I had been having, for a while now, I'd had a couple episodes of like weird chest pain or sudden nausea and like sometimes vomiting. And then that ended up with a trip to the ER because like that time it was the worst pain of my life and couldn't stop throwing up. And I thought like I was having a heart attack or my stomach had ripped open or something. And turned out it was gallstones. And I had scheduled my surgery for January. My work, we do our schedules like a month at a time. So the December schedule came out in November. And the January schedule will come out, theoretically it will come out on either today, because it's Friday, December 18th, or it'll come out on Monday. It's supposed to come out on the 19th, but obviously the 19th is a weekend. So I tried to, I booked the surgery for January because that way we could sort of make the schedule work around me needing to take time off of work to heal, and nobody would have to cover a bunch of shifts for me. But on Monday, so Monday, December 14th, I called my surgeon to let him know he had wanted me to keep him informed if I had any further gallbladder attacks, anything like that, because that might indicate we need to move up the surgery. Also, just, you know, if I'm having attacks and I'm not comfortable and it's affecting my quality of life, like, obviously that's something we would want to address. And I was continuing to have attacks. So I called him on Monday. He called me back while I was at work. And, you know, and I said, like, I've had 2 more attacks. I would like to consider doing my surgery sooner. And he said, do you want to have it tomorrow or Wednesday? Because I've got openings. And so I picked Wednesday because I worked Monday and Tuesday. Tuesday I worked the night shift. So I got off work at 6:30 Wednesday morning. And the surgery scheduler had called. Originally my surgery was scheduled for like 4. So they said, be at the hospital at 2. And then they called on Tuesday afternoon and said, be at the hospital at noon. And then they called at like 6:30 at night, Tuesday night, and said, be at the hospital at 10 a.m. Because your surgery is going to be like around noonish. So we get to the hospital at 10 a.m., you know, get all checked in, get back into the short stay surgery unit. And the nurse, you know, is getting me all ready and stuff. And she goes, so when did they tell you that your surgery is? And I said, well, they said around noon. And she's like, there are a couple of people in front of you, and I would guess that your surgery's not going to be until around 2 or so. And I was like, okay. I mean, like, I had no other plans that day. Like, I was just going to have surgery. So, and I knew once I got the anesthesia and everything that I was going to be useless the rest of the day. So, you know, it's not like I had a big meeting to get to or anything. My sister, because it was kind of short notice, she only had the half day off of work. So my friend Sarah took me to the hospital and hung out with me, watched me, you know, basically like watch me take a nap. You know, was probably not the most exciting thing she's ever done in her life, but she was reassuring me. She's like, oh, it's still better than being at work. Like, she had her laptop there and she was, you know, keeping in touch with work and emailing and whatnot. But, you know, we got to hang out and she got to do whatever she wanted on the internet and not feel like people were judging her because she wasn't technically doing work, because nobody in the hospital gives a poop. So yeah, so surgery ended up not happening until probably 3 or so. My sister said that the surgery itself only took like 30 minutes. When the doctor came out to talk to her afterwards, he said that, you know, the surgery went really well. It was good that I had my gallbladder out because it was enlarged and there were multiple stones. So obviously it was just going to continue to be an issue. But he also mentioned that if he didn't know that I had had weight loss surgery, he wouldn't necessarily have guessed. I mean, obviously my stomach is a much smaller size than a normal stomach, but he said that my stomach has healed beautifully and it's not obvious that it has been surgically altered, which I was just like, yeah, because, even now, like, I'm almost a year post-op, like, what, 9 months post-op? People still, when I tell them, like, oh, I had my weight loss surgery in Mexico, like, people are still really judgmental and racist about it, like, oh my God, weren't you scared that you were going to get this nasty infection and it's Mexico and everything's dirty? And it's like, it's an international center of excellence hospital. Like, everything was very clean. The staff was incredible, Like, I had stricter pre-op and post-op rules and restrictions and stuff than some of my friends who've had surgery here locally. Like, it's the individual surgeon and stuff, but it's still, and I know it's kind of my own internalized racism, but it was still really reassuring to have a very well-respected local surgeon say that Dr. Ortiz did a great job and that my stomach looks amazing. Plus, having had the gallbladder attack on December 3rd, where I thought, like, oh my God, my stomach's ripped open. That's what's causing all this pain. Like, no, apparently my stomach is peachy keen. It's just fine. So it's very reassuring. But yeah, so the surgery went really well. I remember hanging out in basically like the short stay surgery waiting area for hours because, I had an IV in, but I didn't have any pain meds or anything on board yet. And then when they came and got me around 3 to take me down, they gave me the Versed, which relaxes you and makes you feel like everything's going to be okay. I remember getting onto the OR table, and then they put a mask on me, and they're like, just, take some nice deep breaths. And I remember, like, I was breathing, and I remember the mask started to bother me, and I feel like I started to mess with it. But, like, my memory is so foggy. It's like, I don't know if I was just, like, batting at it or if I was, like, trying to rip it off kind of a thing. But they came over and, like, I remember them coming and then gone. Nothing. So, hopefully I didn't make a fool out of myself. When I woke up in recovery, I was super nauseous. I hadn't eaten, I wasn't supposed to eat or drink anything after midnight. I did sort of cheat. I had been working on one of my Isopure clear protein drinks, and I was at work, so I don't think I got that finished until like 1:30 or 2 in the morning. But that was still, 13 hours before I went back for the surgery, so by then my stomach was empty. So there was nothing to actually throw up, but I was gagging, and and I had just had surgery, so like my incisions hurt a lot, and I was really nauseous. So they gave me pain medicine, and they gave me anti-nausea medicine, and it took me, and I had to wear oxygen, which that happened with the VSG surgery too. I, just not breathing as well as I should be after anesthesia, and I had to have oxygen. My sister said the surgery itself only took 30 minutes, and they said I would be an hour up to 2 hours in recovery, and she said I took the full 2 hours to, before they moved me back. So apparently I'm one of those people that doesn't shake off the anesthesia real well. And I kept, oh my gosh, I do remember bits and pieces of, the recovery because, and the rest of the night, I was so doped up. And they would ask, like, are you in pain? And it's like, yeah, I'm still hurting. And so they gave me more pain medicine. But then I was so stoned, so high, that I would fall asleep while I was talking to my sister. We would be having a conversation, and all of a sudden she would realize she's asleep. Just passed out in the middle of a sentence. So, I'm sure that was entertaining. And at one point I was just like, oh, and I remember because they wrote me a prescription for oxycodone to take it home. And they wrote it, the pharmacy that I use is at the Fred Meyer, that's like a mile from my house. But that pharmacy closes at 9. And so, and we were at Legacy Good Samaritan, and so we're a ways away. So, I remember it gets to be 8 o'clock, and I'm like, we should really get on the road. We need to leave if we're going to go home and get my pain medicine, so I have it tonight. And I remember just, asking the nurse, can I go home now? I haven't... So we had to get up, we had to go to the bathroom, because they had to make sure that I could empty my bladder. Had to get dressed. She came in to do the discharge education with me, and I remember fallen asleep during the discharge education, which I'm sure just gives her the reassurance that, oh yeah, you're good to go home, you idiot. And originally I'd been like, oh, I don't need anybody to spend the night with me, you know, like I'll be fine. I'll just be sleeping. But I think my sister and the nurse probably saw that I was stoned out of my mind. And so my brother-in-law stayed at my house, you know, and I was like, I remember when I went to bed, I remember laying in bed thinking, my brother-in-law's name is Will. And I remember thinking, does Will still exist if I can't see him? And I was really confused by it. And I thought maybe I should call my sister to check. But I fell asleep before I could, you know, like finish the thought and reach for my phone. So yeah, like obviously pain medication and I are just like, hey, we're sleeping buddies. Like I'm going to be tired and loopy and it's going to be kind of a joke. My pain since the surgery has been pretty well controlled. The surgeon's having me alternate ibuprofen and Tylenol. So today I woke up at 10 a.m., took some ibuprofen. So at 1, I'll take Tylenol, and at 4, I'll take ibuprofen, and just kind of alternating them like that. And then when I go to bed, I do take the oxycodone. I'm not having any, like I noticed yesterday, I'm not really having any pain from my surgical incisions. The actual pain is in my shoulders, and that's from the CO2 because, you know, laparoscopic surgery. And that's very similar to what I experienced after the weight loss surgery. So, I mean, that's nice. Like, everything seems to be healing really well. I don't have much bruising. I haven't really done a skin flick in a while, so I'm going to show you guys kind of the scars. I'm going to have to scoot this back. Hang on just a second. Let's see if I can manage this. Okay, and we'll click this down. All right. Okay. Oh, yeah, and then these are my sister made me new leggings as a happy gallbladder surgery present, because I love Nightmare Before Christmas, and they're cute little sugar skulls. So, oh, and she also, yeah, and she made my underpants. These are Big Hero 6. My sister likes to sew, and she's really good at it. So anyway, so these scars are from my VSG surgery. So you can see, like, they've healed really nicely. Like, they feel pretty smooth, you know. They're not really very exciting anymore. Okay, so this is the first one from my gallbladder surgery. And then these are the other 3. So we got a little one, another little one, and this big one. And they've still got the Surgiglue on them. So I'm allowed to shower. I can't soak them. Oh, I guess here. In terms of skin from the surgery, like I've lost 116 pounds. So like, this I'm not real thrilled with, you know, and it's got the weird sort of Shar-Pei, like bloop, bloop, double butt thing happening. But for the most part, I mean, if I have pants on, if I have leggings on that have some kind of compression, it looks okay. It's not too bad. But yeah, so I mean, in terms of just like the incisions, they're sore, you know. I mean, it's very similar to the VSG stuff. The incisions are sore, but it's okay. My shoulders ache, so I'm just trying to, you know, I've got my heat pad and I'm trying to walk and just making sure that I'm taking my Tylenol and ibuprofen. In terms of eating, like yesterday and today, I'm just like not super interested in eating. My brother-in-law took me to the food trucks near my house yesterday so I could get some beef pho because I was craving it. I still have at least half of it left. So I'll probably be snacking on that throughout the day. Other than that, just really, the idea of like solid food is really unappetizing. So like sticking to sort of my I've got some Isopure clear protein drinks left. So, you know, doing those, and just trying to get walking and movement in and everything. So in that regard, it's very similar to my post-op VSG stuff. The incisions are higher, so I find less restriction with my movement. You know, like if I twist, specifically when I'm trying to get out of bed, like that's when I notice them the most. But in terms of like getting on and off the couch, like they're a lot higher, and so they don't seem to be affecting as much. And like my sports bra doesn't come down low enough to bother them. My leggings don't come up high enough to bother them. So in terms of clothing and stuff, I feel a lot less restricted with these. I do find just, and I'm sure it's just sort of like a psychosomatic thing, the sports bra and the leggings have that really mild compression, and that feels comfortable right now. Like when I was wearing my loose fleecy pants, like it was okay. But my whole abdomen's kind of achy, and so just the slight compression that the leggings give, like that helps. But yeah, other than that, this video is 15 minutes long, so I think I'll cut it off. I hope you are all doing great. I hope none of you have to deal with gallstones because it sucks. Again, I've never been pregnant or had babies, so I don't know that pain. In terms of my life, this was by far, like, the gallstones themselves when they were passing, the worst pain I've ever experienced. So I hope none of you have to deal with that. But if you do and you're in the Portland area, I highly recommend Dr. Singh at Surgical Associates, and he works with Legacy Good Samaritan. Everybody there was amazing. Like, it was great. I can't speak highly enough of them. So that's all for now. I will check in with you guys again on Monday, and I hope you're all doing great. Bye.